Hello friends, I am Dr. Girish Bhalerao, Senior Chief Consultant Orthopedic Surgeon here at Mumbai. Today we are going to talk about sports medicine in its own specialty and what challenges do patients get and how to recover from them. So sports medicine is a very wide subspecialty of orthopedics which involves any peri-articular soft tissue injuries posing instability issues in the joint. Typically affecting the joint is knee joint and shoulder joint. Being the most highest mobile joint, these joints are stabilized by their own ligaments and tendons and structures, which allow them to give you graceful movement, which can be used during challenging activities like sports, athletics, dancing, and even in your routine activities. So, what happens in joint instabilities? There are structures called ligaments which connect bone to bone and offer stability. Similarly, there are structures called tendons which connect muscle to bone, offering you mobility. Many a times, depending upon your chronicity, depending upon your causality, it can be either a degenerative tear or it can be a challenging activity which has caused you to have an acute tear. These tears can be classified as partial tears or complete tears or an avulsion injury. In either of the scenarios, what typically happens is that the stability of the joint is challenged. Sometimes in joints like shoulder, patients, especially having diabetes or thyroid or some chronic issue in which they do a lot of overhead activities, can have conditions like frozen shoulder, rotator cuff tears, and so on. So all these periarticular soft tissue injuries can be corrected through a minimal invasive approach in which we take a half centimeter stab knife incision and introduce a 4 millimeter or lesser than that camera system to gain access of your joints. With this minimal invasive approach, we can take care of any and all soft tissue injuries which has happened across any corner of the joint, can identify them and correct them. To correct them, we can take sutures, we can do ligament reconstructions, we can harvest graft from your bodies, we can have some synthetic grafts into play in which the joint instabilities will be corrected and you can get back to your activities not only of your daily routine but also of your sports and anything of your choice. So in this case scenarios, what we require is a very specially trained doctor and specially formed logistics for it. So I am India's first doctor to be trained on FIFA grounds, and I'm proudly telling you that I am a FIFA-trained sports specialist, in which my training has happened at FIFA Center of Medical Excellence, Portugal, and have an opportunity to treat such specialties or such kind of athletic injuries over more than 15 years of experience. With this into play, we help you to get back to your customized physiotherapy and rehabilitation program with proper techniques, observing your original anatomical footprint. We offer you the original anatomy back, and as soon as possible we can offer you a return back to your sports activity. In case of any joint injuries or instabilities which are not getting settled on its own or even after a conservative line of management, please seek help and get back your freedom to play your favorite sport. Thank you.